Welcome. In today's session, we are going to look at the arterial supply of the thigh. And by the end of this session, you should describe the course of the main arteries of the thigh. In fact, it is the femoral artery in its branches. You should also know the anastomosis of the thigh and the arteries constituting those anastomosis. And finally, we look at the clinical correlations. Welcome all. My name is Wallace Munyeri, and I'm the Yure Daktari. So let's start with the arterial supply of the lower limb. It is by the common femoral artery. Now, the common femoral artery is the chief artery of the lower limb, and it is usually a continuation of the external iliac artery. When it passes underneath the inguinal ligament at the mid-inguinal point to enter the femoral triangle, the external iliac artery changes its name from that name, external iliac artery, to the common femoral artery. Now, then it runs downwards and medially successively through the femoral triangle and adductor canal. In the adductor canal, it usually gives off a branch known as the descending genicular artery. And the descending genicular artery will give you two branches, the saphenous branch and the articular branch, sorry. Then at the lower end of the adductor canal, which is usually found at the junction between the middle 1/3 and the lower 1/3 of the thigh, it leaves the thigh through the adductor hiatus to adductor hiatus, as I had mentioned earlier, is opening the adductor magnus muscle to enter the popliteal fossa. It continues as the popliteal artery. Now, the largest branch of the common femoral artery is the Profunda femoris artery, which is also known as the deep femoral artery. And after giving off the Profunda femoris, the common femoral artery, it will change to superficial femoral artery. Okay. So here we are. So you can see this is the inguinal ligament here. So let me take this here. Here is the inguinal ligament. Then this is the external iliac. Then after crossing, this is when it is in the femoral triangle, in the lateral compartment of the femoral shield. Here it is the common femoral artery. Then it will give off the profunda femoris, this largest branch here, and continues the superficial femoral artery. Then here at the adductor hiatus, it will enter the popliteal fossa through the adductor hiatus and change its name to the popliteal artery. Then you can see here we have a branch, the descending genicular artery, which will give us saphenous branch, which will follow saphenous nerve, which is a cutaneous branch of the posterior division of femoral nerve, and will give off also an articular branch, which will go to participate in the formation of the genicular anastomosis. So then let's look at the first shoot. Okay, so understand that. Then let's continue. Here is a diagrammatic representation of the same. Here you can see this is the inguinal ligament. Then you can see the most medial compartment here is the femoral vein, then the femoral artery, then the femoral nerve here. Then you can see this here is the profunda femoris artery. Then it has branches, the lateral circumflex femoral artery and the medial circumflex femoral artery. And then it continues here, and this branch will give off the perforating branches. Then you can see it is continuing to enter. Here we have cut and reflected the sartorius muscle here. The sartorius muscle has been cut and reflected to expose the contents of the subsartorial canal or the adductor canal here. So you can see here it is running in the adductor canal. The same case applies here. You can see this is a femoral artery. Then this is the common femoral artery. This is the superficial femoral artery. This is the deep femoral artery, also known as the profunda femoris. You can see it has several branches, the lateral circumflex femoral and the medial circumflex femoral. You can also see before here it exits the adductor canal is giving off the descending genicular artery. So profunda femoris artery. It is the largest branch of the femoral artery, and it is the chief source of blood supply to the muscles of the three compartments of the thigh, the anterior, medial, and posterior compartments. Or their blood supply are derived from the profunda femoris artery. It usually arises from the lateral side of the common femoral artery. Sorry, here I should have indicated common femoral artery in the femoral triangle, about 4 centimeters below the inguinal ligament. Then behind the femoral vessels, giving off. So these are branches from the profunda femoris, medial and lateral circumflex femoral arteries. It then passes posteriorly between pectineus and adductor longus, then descends close to the femur, and this is a very important. We'll say you will see why you need to know the cause, why you need to know it lies close to the femur, then successively between adductor longus and adductor brevis, then between adductor longus and adductor magnus. Then here as it lies between the adductor, as it lies on adductor magnus, it will give off the first 3 perforating arteries, which will perforate the muscle, the adductor magnus. Then its terminal part pierces the adductor magnus as the 4th perforating artery to reach the back of the leg, and they will form the longitudinal anastomosis. Let me show you that. Now, branches of the profunda femoris artery. Here you can see this is the common femoral, this is a superficial femoral, then this is a profunda femoris. Then it has branches here, the lateral circumflex femoral, medial circumflex femoral artery, and then it continues and gives off perforating branches. These perforating branches, those are muscular, sorry, these are the perforating branches. You can see there are 1, 2, 3, then it terminates as the 4th perforating artery. Here you can see it is the profunda femoris, lateral circumflex femoral artery, medial circumflex femoral artery. Then from this branch, we have the perforating branches. So let's talk about some key anastomosis of the thigh. The key anastomosis of the thigh include the cruciate anastomosis, the trochanteric anastomosis, the longitudinal anastomosis, and the genicular anastomosis. I think it is not found in the thigh. It is on the anterior aspect of the knee, but it is a key anastomosis of the lower limb. So I put it here too for us to discuss the anastomosis. Now let's start with the cruciate anastomosis. As the word says, cruciate, from the word cross. So because why? It is cross-shaped. So it looks somewhat like this. So it is found at the level of the middle of the lesser trochanter, and it is formed by the transverse branch of medial circumflex femoral artery. So maybe this is the transverse branch of the medial circumflex femoral artery. Then we also have the transverse branch of lateral circumflex femoral artery. This also is the lateral branch of the transverse branch of lateral circumflex femoral artery. Then also by the ascending branch of the first perforating artery. So this is the ascending branch of first perforating artery. Then also by the this is the descending branch of inferior gluteal artery. Okay, so those arteries constitute the cruciate anastomosis. It looks like a cross. So just draw across like that. This is there. If this is the medial side, and this is lateral. So this is the transverse branch of medial circumflex femoral artery, transverse branch of lateral circumflex femoral artery. This is the ascending branch of the first perforating artery, and this is the descending branch of the inferior gluteal artery. So here it is, and it lies at the level, at the middle of lesser trochanter. Here it is. As you can see by this ascending, the transverse branch is here, and this is the descending branch of inferior gluteal. So remember, inferior gluteal is a branch of the anterior division of the internal iliac artery. So by this, we are connecting the internal iliac artery to the common femoral artery. So let's continue. Maybe I take back my pointer. So then we have trochanteric anastomosis. It provides the main source of blood for the supply of head of femur, and the anastomosis usually lie near the trochanteric fossa. Remember, in the trochanteric fossa, what was inserting there? Is it the obturator externus muscle? And it is formed by the following branches: descending branch of superior gluteal artery, and then the ascending branches of both lateral and medial circumflex femoral arteries, and the inferior gluteal artery usually join the anastomosis. So I usually draw it like this. Okay. So this is the descending branch of superior gluteal artery. Then we have two ascending branches of, this is the ascending branch of lateral circumflex femoral artery. If this is the lateral side and this is the medial. So this is the ascending branch of, this is the ascending branch of lateral circumflex femoral artery. This is the ascending branch of medial circumflex femoral artery. Then the inferior gluteal artery will join. This is the inferior gluteal artery. Okay, so this is the trochanteric anastomosis found near the trochanteric fossa. Here it is, trochanteric anastomosis here. So then from the trochanteric anastomosis, we will have branches which usually pass along the femoral neck with the retinacular fibers of the capsule to supply the head. Those branches are known as the retinacular arteries. Okay, but most of the posterior retinacular arteries are given off by the medial, the ascending branch of the medial circumflex femoral artery. So medial circumflex femoral artery is a very important artery for the supply of blood to the head of femur via the retinacular arteries. So that is that. Then let's look at the other anastomosis, which is known as the longitudinal anastomosis. It is the main arterial supply to the back of the thigh, and it is derived from the perforating branches of the profunda femoris artery, the deep femoral artery. Now, the perforating arteries usually pierce the adductor magnus, and after piercing the adductor magnus, each perforating artery will divide into ascending and descending branches. Now, remember the ascending branch of the first perforating artery was forming the cruciate anastomosis. Then close to the posterior aspect of the insertion of adductor magnus, we have a chain of longitudinal arterial anastomosis, which is formed by the ascending and descending branches of the four perforating arteries. So it is, so you can see after piercing, it will divide. After here they are piercing, maybe adductor magnus muscle is there. After piercing, they are dividing into an ascending and descending branch. Remember, the ascending branch of the first perforating artery participates in formation of cruciate anastomosis here, and also the descending branch of the fourth perforating artery will anastomose with the superior muscular branch of popliteal artery. So this chain of longitudinal arterial anastomosis is the one which is known as the longitudinal anastomosis. So let's look at the final anastomosis, which is the genicular anastomosis. It is found on the anterior aspect of knee, and this anastomosis usually maintain adequate blood supply to the knee joint and leg, especially during flexion of the knee joint. When you flex your knee joint, the blood supply via the popliteal artery becomes sluggish due to kinking of the artery. Sorry for not indicating that, but when during knee flexion, the popliteal artery may become kinked and the blood flow through it becomes sluggish. So through this anastomosis, blood supply to the knee is maintained. It is formed by the following branches: superior medial genicular artery, superior lateral genicular artery, inferior lateral genicular artery, inferior medial genicular artery. All these are branches from the popliteal artery. Then we have the descending branch of lateral circumflex femoral artery. We also have the anterior tibial recurrent artery. We also have the circumflex fibular artery, and we also have another branch, the articular branch of descending genicular artery. So here we are. So I think this anastomosis has plenty of arteries. So here you can see now this artery here. This is the descending branch of lateral circumflex femoral artery. Then here you can see the superior lateral and the superior lateral genicular artery. You also have the superior medial. You also have the inferior medial, inferior lateral. Then we have the anterior tibial recurrent from your anterior tibial artery. Then we also have the circumflex fibular artery from the also anterior tibial artery. And we also have, I think, posterior tibial recurrent also from the anterior tibial artery. So those arteries, and not forgetting the articular branch from the descending genicular artery branch from the superficial femoral artery before it crosses the adductor hiatus. So all those arteries participate in the formation of this genicular anastomosis. So those are the anastomosis of the lower limb. Then here, maybe this is just a diagrammatic representation. This is the popliteal artery from posterior aspect of the knee. Then you can see here it is given. This is the superior medial genicular artery. These are the inferior medial genicular arteries. And these are the lateral branches. Superior lateral, then inferior lateral. Then here you can see this, which is piercing the posterior aspect of the knee capsule. That is the medial genicular, which supplies the intracapsular structures, but it does not form the genicular anastomosis. Note that the medial genicular artery does not participate in the formation of the genicular anastomosis. So clinical correlations. The longitudinal arterial anastomosis of the back of the thigh, what is its clinical significance? It usually provides collateral channels of blood supply to the lower limb by bypassing the external iliac and the femoral arteries. How? Remember, the longitudinal anastomosis, it is formed by the ascending and descending branches of the perforating branches. And remember, the ascending branch of the first perforating artery, it participates in the formation of the cruciate anastomosis. And in the cruciate anastomosis, we have the descending branch of inferior gluteal artery. So inferior gluteal artery is a branch of the internal, the branch of anterior division of internal iliac artery. So let's say you ligate the femoral artery, you ligate the common femoral artery. So after that, you see, you will obliterate blood supply through the profunda femoris. But since the blood supply through the blood will reach the longitudinal anastomosis via the internal iliac artery, because blood will go through the internal iliac. Remember, we had the abdominal aorta here, then it bifurcates into common iliac, then common iliac artery will give external iliac and internal iliac, Internal iliac has two division, a posterior division and an anterior division. Now, from the anterior division of internal iliac, we have the inferior gluteus. Then, inferior gluteus will form the participates in the formation of cruciate anastomosis. Then, via the cruciate anastomosis, the ascending branch of the first perforating artery will be connected here. So, blood will be flowing. Blood will bypass the external iliac artery and the common femoral, and we pass through this channel, collateral channel. So there will be still some blood supply to the lower limb. Also, what is the clinical significance of that? Why have we learned the cause of Profunda femoris? It is of great clinical importance since it is deeply located and lies in close proximity to the femoral shaft. Hence, it is usually prone to injury in fracture of the femoral shaft. So if patient has a fracture of the femoral shaft, the artery which is most liable to injury is the profunda femoris. Also, it is liable to injury during a surgical procedure of fixing metallic screws in the femur by an orthopedic surgeon. So orthopedic surgeons, they should be careful when they are inserting screws, fixing metallic screws in the femur, so as not to injure the profunda femoris artery. So thank you for your attention, and please subscribe for more anatomy and biochemistry content. Thank you.